There was one patient in particular who was driving down a state highway in Texas and was T-boned and flipped his car over, and his only injury really was to his left upper extremity. He was driving with his one hand on the steering wheel and the other hand left out of the truck, and he rolled the truck onto his arm and had a very horrific injury to the upper extremity. He had a fracture of his humerus, which is the bone in your upper arm. He had completely destroyed the main artery going to the arm, and he had lost all of the skin and soft tissue down to the muscle, going from basically his armpit down to the mid-level of forearm. In many places, this would be a multi-specialty care type of injury involving orthopedics and vascular surgery and plastics and plastic surgery. In this particular institution, however, the hand surgeon whose base training was in orthopedics, but whose main abilities to take care of this injury came from his hand fellowship, I was able to assist him in the care of this patient. In many places, actually, this patient probably would have lost his left upper extremity, especially if the time to transport to the hospital would have been greater. The hand surgeon asked me to harvest a vein from his leg, and we were able to reconstruct the artery to restore blood flow. Then we placed a temporary dressing over the wound, which is obviously quite extensive, and he also placed what's called an external fixator device into the bone to stabilize the fracture. Once that was done, we took him back to the operating room 2 days later and rotated the latissimus muscle from his back and placed it over the wound to provide coverage, along with a portion of the skin. And the patient left the hospital in about 2 to 3 weeks with this left upper extremity intact. And it really was quite amazing. And when I began probing deeper into where he learned how to do all of this type of surgery, it basically came from his hand fellowship.